Okay, let's see. Let's see what's happening. I've got a little bit of a different setup today, so let's see if this works. Hopefully there'll be less freezing. Let's see. Just want to do grab a couple of things and then close out this second window so it won't cause people my video to freeze. See, I'm not sure. So this is new to me. There's a little setup. I wish you guys can see it, but let me see. A little bit of a different setup. Allergies are bothering me so bad. Just gonna see if this works. You guys let me know if you can hear me okay, and if the video's looking good, post something in the comments. Just trying something a little different. See if I can get this to work while I'm doing this. I know I'm on fire right now. Okay, let's see if I can move this over. Okay, so far. So far, only one person. See if this gets out there. This is a different type of setup I've got on a different device right now, not my phone, because it always seems to freeze up with my phone. So I want to see if this is actually going to be a better platform. Talk real quick. I'm just it's not gonna be long, just a few minutes. Just want to talk about a couple of things. Reopening, his 12 points plan, test, trace, isolate, people who have tested positive today. And I mean, just proof that we need to slow down in opening. So if you can hear me okay, just post something in the comments. If the video's looking okay, let me know. So reopen or not, we talked about this briefly yesterday, and the governor had 12 points on reopening. Oh, my glasses, I keep forgetting. He had a couple of points on reopening, a couple of 12. And today he kind of rehashed some of those, but with former Mayor Mike Bloomberg helping out with getting those test and tracers. So I like his 12-point plan, and I'll just say it real quick. So one is in order to reopen, we need to not make sure that we don't overwhelm the hospitals. Today, 4,681 people tested positive. And he said, we're probably going to have another 4,681 people test positive today. So for all of those who are saying we need to open back up because the economy and blah, 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 you can't really have a functioning economy if you don't have people to actually work, make money, and spend money. If we open back up too soon, people will get sick, which means they won't be able to work and they will die. So if we have 4,681 people who tested positive today, and even in the 49th Senate district, we've got more people who have tested positive in upstate New York. This is not just in the city. I think that his plan to reopen slowly is definitely a smarter one, as he was saying. So we don't want to overwhelm the hospital's capacity to actually take people, like what happened in the first portion of this pandemic. Of course, we weren't ready. We didn't know. So being that our curve is slightly flattening, we don't want to cause a spike. like we're seeing in other countries and other states. So, and then he has an industry phase 1 and phase 2 for industries like construction and manufacturing, which would be phase 1 to open up, and phase 2 identity businesses. And I think this was mine's, like which ones, non-regional ones, I guess. I'm not sure how he's going to go about doing that, but I really hope that with all the testing, the tracing, and the isolate, that all of that happens first in the next couple of weeks before he even thinks about opening certain industries. And then he says, what businesses precautions will be in place, social distancing, and PPE monitoring. That kind of brings up some news that I had seen today. There's going to be protests of workers in Walmart and Target, I guess, and other essential workers, or I call them essential heroes. They're going to be protesting because they're not given the proper PPE equipment. And an inspector, a health inspector, actually went into one of these Walmarts and realized that there was a lot of employees. I think it was a Walmart. I didn't see which one. I didn't have time to read the article, but I had seen it real quick before I started the live. But 23 employees tested positive for COVID-19 in this Walmart. And when the health inspector went to look, what happened? There were a lot of workers who did not have masks and all. So that's something that we have to really make sure that that's happening. Healthcare capacity, he says that we don't want to reach over 70%. The flu season is coming up, so we have to stockpile on equipment, PPE, testing regimen, and that goes to the test, trace, and isolate. And I'm really curious how they're going to do this. Johns Hopkins University is an awesome university. So with their medical facility and their school themselves, I've had a lot of students who I helped get into that university. I'm sorry, my nose is itching because I have allergies. But the fact that Mayor Bloomberg is actually helping with this test, trace, and isolate, and trying to get tracers to actually isolate, to trace contacts of people who have tested positive. I think it's going to be a huge undertaking, and I really, really hope that it actually works and gets going. They want isolation facilities. I'm wondering if they're going to use the Jacob Javits Center as that or not. I'm not really sure. Regional coordination with schools, transportation, and testing, tracing. Now, I think that the idea to actually shut down the subways to disinfect the subway trains, the trains, I should say, between 1 a.m. and 5 a.m. was a really good idea that should have already been done. I mean, a lot of these things, I don't know why it's taken so long to actually come to these conclusions, like, hey, maybe we should shut it down and have this period of time where we're actually cleaning the trains or buses or whatever. I'm not sure why that wasn't happening, but it's happening now, and that's great. I will say this, I was not happy with the fact that when he spoke yesterday about the, was it yesterday, day before yesterday, he spoke about the homeless people, not the homeless persons who are on the train because they have no place else to go. And he said it was disgusting. There's no coming back from that, like really disgusting. I used to be homeless, and if he were to call me disgusting because I'm homeless, I was homeless. Yeah, I know I definitely was not disgusting. Neither were my children or my husband because they were homeless with me. So there are a lot of different reasons why people are homeless, and not everyone, is a bad person or smells or is on drugs or have some mental issues. There are different reasons why people are homeless. And the fact that he called them disgusting, he being the governor, Cuomo, called it disgusting and disrespectful. Like, anyway, I just want to say that. So he said he's going to set up a regional coordination for schools and transportation to get testing. And he says he's going to reimagine telemedicine. Actually, telemedicine has already been sort of being reimagined. If you're not sure what telemedicine is, It's actually one of my students. She was coming online to do class, and she was late because she said my daughter had a doctor's appointment, and I almost freaked out. She's like, "Miss T, don't worry about it. We actually was doing it, through a video call. So it was the baby's checkup, and the doctor was on the I was like, wow. I was like, I didn't even think of that. I didn't think that that would be happening now, that people would actually have to go into the doctor's office to, see the doctor for anything. But telemedicine is definitely something that is being done already. Teleeducation. I'm an educator, so I am actually teaching my students remotely. It is not the most ideal situation, but it is happening. Regional control room and protecting and respecting essential workers, testing equipment, public transportation, disinfectant. That's his 12 point. And that leads into his test, trace, and isolate. He says it's going to need 6,400 tracers to 17,000 tracers to accurately connect the different contacts that people who test positive had. And I'm really, really curious to see this. Like, my brain is like doing all of this connect the dots stuff. So I really want to see how that's going to happen. And I just wanted to know, let's see, Vivian, please slow down, reopening. Yes, exactly, right? Let me see. Look at how well we've done in Australia and New Zealand. Keep testing. Yes. Don't overwhelm your hospitals. Yes. They won't be able to cope. Yeah. And I'm actually going to be speaking, and you're right, Vivian. So I'm actually going to be speaking next week with a doctor and possibly a nurse who has been on the front lines. And they're going to, and this is local. This is not like some distant person, probably people you've known, or you've met before, maybe your doctor, I'm not sure. But they're going to speak about their experiences during this pandemic on the front line and how people have been overwhelmed. And also how doctors themselves are dealing with this. In the news, if you haven't been paying attention, a couple of doctors have already committed suicide. And there are some nurses and other health professionals who are really suffering because of this pandemic, and not only getting sick and some dying, but they're also suffering because of the being overwhelmed in the hospital. So we're going to speak to a doctor and actually ask her to share her story and experiences with her coworkers, nurses, and other fellow doctors and things like that. So, and also we have been doing COVID updates since I think we started our COVID page about 4 weeks ago now, five weeks ago. As soon as we had the shutdown, lots of people were calling and asking questions about where they can get information on unemployment. And then when the stimulus check came around, people were asking all that. And so my team has actually helped with the research and put together a page, COVID-19 page on teresaforsenate.com. And you can go there and get all the updates. It's updated daily, whatever the governor's saying, whatever the total amount of positives and deaths, everything in the district specifically, whatever's been updated in the district, we try to get that immediately and put that up on the website as well. So if anyone, let me see, hold up, let me scroll down. So that's teresaforsenate.com. And that's the COVID-19 page. Hold up a second. And if you would like to volunteer and help us get some of that, some more research and information for people, local information. We're mostly hearing a lot about New York City, which I just said to my husband, I said, New York City has to be hell right now. We have family members down there. So I know that at least for them, that it is not the best situation. We've lost 3 family members already. So to this disease, and other people are reporting out like the horrible situations and I don't even want to mention certain things that people have been saying. Is very disturbing. but I am very curious to hear from the rest of you up here if you have family member and members, I should say, down in the city. I just would really like to know how they're faring and what they're doing to stay healthy, stay safe. If they have access to personal protective equipment as well, like masks or gloves, how's that going for them? And speaking about masks and gloves, next week we are going to actually be distributing some masks to a specific location. We're going to post all that stuff in Schenectady. There's obviously, I wouldn't say obviously, but if you don't know, Black and brown communities are the most hit with this virus. They're definitely suffering, and we can all imagine or realize why that is happening. And I think at least a week and a half ago, Trump said, I don't know why this is happening. Yeah. And testing just ramped up a lot in Schenectady for the minority community so that they can figure out why that's happening. I'm not really sure how testing is going to reveal the reason why. I think if we just open our eyes and see why that's happening in Black and brown communities, that's the communities that are always ignored and the first to get sick and the last to get help. It reminds me also, my daughter said to me the other day, she was like, one of my questions for my online classes, her social studies, was about the Great Depression. And they asked the question was, how did the Great Depression actually affect Black Americans? And I said to her, well, there's a term, it's called last to be hired, first to be fired, first to be fired, last to be hired. And of course, even with the alphabet soup of organizations and that FDR dreamt up to save the economy, a lot of those jobs were very technical jobs that were not a part of what Black and brown people actually worked in. And that's a lot of things that's happening right now. So, I mean, this is very reminiscent as a historian. This is where my brain goes to, and I go, this sounds a lot like that. And why aren't we paying attention? Why aren't we doing more to protect all people? And testing is not enough. And I know, Vivian, you said testing. Yeah, we need to test before we open up, before we reopen at all. We need to test and trace and isolate, but we have to do a lot more than that. We have to make sure that everybody is fully educated as to how the virus is spreading. Believe it or not, a lot of people out there do not either believe the fact that this virus exists or that it spreads the way it does and that everything's just fear mongering, or they just don't have access to the information. And what we're trying to do is make sure that everyone has access to that information. We've been calling everyone in the district, of course, our family and friends. We're trying to get mailers out to everyone with all that information, especially with the primary coming up. The presidential primary was canceled, all the different changes and everything. There's still thousands of people who do not know, who have absolutely no idea, and they're getting their information from Uncle Kenny, Uncle Bobby, Aunt Susie, and Aunt Susie, Uncle Bobby, Uncle Kenny probably don't even have half of their information correct. So we want to make sure that we're actually reaching these people. So if you want to help, if you can help, and please do help us get as many people the information as possible. Those people who do not have access to internet, we would like to mail them some information and make sure that they understand what's going on, what the next phases are, and everything that's going on, especially with elections. You can donate at our Act Blue link. It should be in the comments, and donate anything that you can. Every little bit helps. We're trying to reach as many people as possible so that they know what's going on. And also, if you'd like to volunteer and help us reach those people, you can go to teresaforsenate.com and sign up on our volunteer link where it says join us. And also, if you have any questions, suggestions, comments, you can email me at teresaforsenate@gmail.com, teresaforsenate@gmail.com, and that also should be in the comments. And if there are any questions, comments, just want to say hi. Let me see. Hold up. Let me look. And I'm hoping my video is clear and it's not freezing up like it's been doing, and the volume is good. Let me see. Yep. And if I think that's yeah, I didn't want to go too long because I said a lot yesterday. And again, next week we'll be interviewing a doctor. I'm going to try to do it on next week, Wednesday, for Nurse Appreciation, National Nurses Day, I think it is, a week, National Nurses Week. And then the following week is going to be International Nurses Day on the 12th. So, but next week we're going to be speaking to a doctor, and she'll bring in some of her nurse friends, and we're going to discuss how this has been affecting them, and what they've been doing to cope, especially with their families and everything, and different things that they've had, how they had to change their lifestyles and everything. So, and also we're going to be handing out some PPE equipment next week, and we'll get you all updated on all of that soon. So I don't think I have any more questions. Again, if you have any questions, and you're just too shy to put them in the comments, I don't know why, but you can email me at teresaforsenate@gmail.com if you got comments and you don't want to put it in the comments. Suggestions, teresaforsenate@gmail.com. And if you'd like to help us reach as many people as possible, let them know that they actually have a choice on the ballot this year for their Senate representative, me, New York State, 49th Senate District. You can go to our Act Blue link. It's in the comments. And I really would appreciate your support, and share. I can't wait for next week. We've got some really exciting things going on. For T for Teresa, it's going to be something else, and I can't wait. Can't wait to share this with you guys. Thank you. And I don't have my tea. I actually have a glass of wine because it's been a day. And I'll say this: stay healthy, stay safe, and drink wine. Okay. Thanks, everyone.